It's been several months, and you still haven't had a period. What could be going on? If it's not pregnancy, it could be amenorrhea. Amenorrhea is defined as loss of a menstrual period for 3 consecutive cycles. Many things can trigger amenorrhea, but a thyroid disorder is one of the most common. Your thyroid is part of your endocrine system, and is closely connected to your hypothalamus, pituitary gland, adrenal glands, and reproductive organs. They can all affect each other. Hypothyroidism can negatively affect reproductive hormones that control your periods. As a result, menstrual dysfunction can develop. The most common issues are irregular periods, or full amenorrhea. There are 2 types of amenorrhea. Primary amenorrhea is when menstruation doesn't begin by around age 15. Secondary amenorrhea is when a lack of menstrual bleeding occurs later. It's estimated to affect around 1% of women. Besides missing periods, amenorrhea symptoms such as hair loss, headaches, and pain can overlap with hypothyroidism, an underactive thyroid. That's why if you have amenorrhea or menstrual irregularities, you should always test your thyroid levels. You should also test prolactin levels. Prolactin is the hormone responsible for breast development and also lactation in pregnant women. Most prolactin comes from the pituitary gland, the same gland that produces thyroid-stimulating hormone, known as TSH. Abnormal thyroid hormone levels can trigger abnormal prolactin levels, which can trigger amenorrhea. One study showed that among women with secondary amenorrhea, just over 7% of them had abnormal prolactin levels and over 4% had abnormal TSH levels. In another study of women with secondary amenorrhea, hyperprolactinemia, high prolactin levels, with hypothyroidism was a contributory factor in those with amenorrhea. Finally, another study of women with both hypothyroidism and elevated TSH levels showed that more than half of the women also had high prolactin levels. In all cases, when hypothyroidism was treated, it had a positive effect on normalizing prolactin levels. If you have thyroid-related amenorrhea, hypothyroidism treatment should restore normal menstrual cycles in most cases. The treatment for hypothyroidism is thyroid hormone replacement medication. Monitored treatment, as well as regularly checking your thyroid levels, can resolve amenorrhea and other related thyroid symptoms. You should know, however, that it can take some time before your periods start again and become regular. This video has been brought to you by Paloma Health, the nation's leading medical practice dedicated to hypothyroidism care. Learn more at www.palomahealth.com.